Hi there. Hello, Mrs. Melnikova.
Hello.
All of us use glucometers, but I must confess, we don't read the manual. But we wish the readings on glucometer screens reflected the actual blood glucose level. Tell us, please, what should be taken into consideration?
It's a very important question, Evgeny. Thanks for asking. I'll try to answer it. Both people with diabetes and their doctors need to rely upon the readings of the glucometer. It's very important. Still, I'd like to say that the most accurate findings, which are very close to the actual current glucose blood level, can be obtained not by portable glucometers, but by lab equipment. Modern glucometers, all of them, even the most accurate and upgraded ones, may err. There is a margin of error, and at present, the highest is about 15%. Many people with diabetes are shocked. Let me give you an example to illustrate it. Imagine that an actual blood glucose level is 5.8 millimole per liter. One glucometer will show 5 millimole per liter after applying a blood drop on the test strip. But another glucometer, or even the same glucometer using another test strip, will show 6.5. Do you think this difference between 5 and 6.5 millimole per liter is significant? Is it serious, or can it be neglected?
Well, it seems significant. If the level is 5, I'll be calm, but 6.5 makes me worry.
So 6.5 is a parameter that doesn't fit your individual target range. And you think that this value doesn't fit your normal limits, right?
Honestly speaking, I'd say yes.
That's interesting. In fact, you may just have expressed an opinion shared by many people with diabetes who think of an ideal target levels and try to hit them.
Of course, they compete trying to show a better glucose level.
I wonder if there are winners in this race. Because you may seek to constantly have equal glucose levels, but I must say there is no need in it. Besides, it's impossible to have glucose levels equal to 5, 15, or 20 all the time. Such persistence is impossible under normal conditions, therefore it can be achieved in real life. From the doctor's point of view and from my point of view, findings such as 5 and 6.5 fall within the same range, because both of them comply with the target range. It doesn't seem that a person's behavior will change, because one value is mathematically less than the other. These findings are within the same limits, and we, I mean at least the doctors, do not expect ideal findings because we always bear this margin of error in mind. Another example, the actual level is 20 millimole per liter. We don't know the cause of this hypoglycemia. One test strip of an operable glucometer will show 17, and the other will show 22 or 23 with the same drop of blood. What's worse?
To be frank, both figures are awful.
I agree with you. Neither of the two values comply with the target range. And the doctor doesn't want to find out which strip has erred. They are interested in the cause of this hypoglycemia. Therefore, we should factor in this margin of error. Hopefully, new, more precise glucometers with a lesser margin will appear. But for now, we are quite satisfied with the 15% margin. I'd like to discuss one more thing. It's impossible to assess a person's condition based on one finding alone. At that, the exact value doesn't matter, 5, 8, or 28, because one test doesn't show the big picture. As a patient in the diabetes school said, one is as good as none. Right? Therefore, we assess fluctuations, variations, and trends because only this information helps us understand why the blood glucose level has changed and how adverse blood glucose fluctuations can be avoided. As for your second question, I think you should read the manual to any device, especially to such an important one, measuring blood glucose levels based on which we make far-reaching decisions. Manuals detail everything. For example, they debunk many myths that are still rampant. For example, a lot of diabetes patients still think they should treat their skin with alcohol prior to piercing it before the blood glucose test. No alcohol solution are required either before or after the prick. They are not mandatory. There is no use in it. Moreover, they may affect the accuracy of the test findings shown by the glucometer. Secondly, manuals describe all factors that may affect the precision of the test. For example, everybody knows they should wash their hands and wipe them dry thoroughly. Some think it's a silly and unnecessary guideline, but it's a very wise one because a drop of water from the skin may dilute the blood drop and skew the findings if a glucose-containing liquid gets in. For example, a person was holding glucose tablets before the test or ate a fruit. Then the test may falsely demonstrate elevated levels. Therefore, the manual contains very useful information that shouldn't be neglected, although all glucometers are user-friendly and you can't make a bad mistake.
Thank you. We will follow instructions and remember that perfectionism is not always an option.